you for agreeing to be part of the Ignorance Project. So, to kick it off, you want to just go ahead and introduce yourself?
Sure. Well, thanks for having me, Shireen. I
Mhm.
really appreciate it. I'm really proud of everything you're doing with this.
Thank you. Thanks.
Well, yeah, quick introduction. My name is Brianda Molzak. I've been a nurse for coming up 10 years now. This August will be 10 years. I
10
cannot,
years.
yeah.
Okay. Time is
I
flying.
time is flying for
Yeah.
sure. Um, I've been I've worked in several different specialties, from step down ICU to public health, education, higher learning, cardiac, nursing, just a myriad of different disciplines,
You've
which
done
I
it all.
I've done a lot. And I'm really grateful that I've been able to the field and actually like kind of walk around and get my feet wet in different
Mhm.
spaces. And I think that's one of the beautiful things about nursing. You can really spread your wings. Like you get bored in one area, or you're just curious about something else. You want to learn more about that specialty. There's usually an opportunity for you to kind of move over and learn more. So I've done a lot in the 10 years. I'm really grateful for the career I've had.
It's funny because I never think about there being variety in nursing until you just said that. Because I always just picture you going in and like you're dealing with sick people every day, then you go home. So, and you forgot one of
Oh,
your credentials, by the way, Dr. Novak. I
yes. In
have to.
2017, I did complete my so I walk it back a little bit. I went to Oakland University, completed my BSN in nursing, and passed the boards in 2012.
Mhm.
And in 2017, I did a bridge program, so I went straight through and I completed a doctorate of nursing practice in
Okay.
2017. So that's how I got into higher learning and
Yeah.
doing policy work and all that good stuff.
Mhm.
But with the pandemic, it kind of walked me back to bedside. So I do a
Mhm.
little bit still, but
Right.
yeah,
Yeah, I've
definitely.
always admired you and your hustle because you know how to. I've never known anyone to like have and like shuffle so many jobs and just do it with ease because you make it look easy, and I know it's not.
Girl, I'm making it look easy because I'm tired. Tired. I have so many people tell me to sit down, and this year I'm learning to sit down a little bit
You're
more.
learning to sit and good. Okay, we're going to talk about that too because I have something I want to bring up in a few. But first, like, what made you want to become a nurse?
I think one of my inspiration really was my dad.
Mhm.
My dad was unfortunately was diagnosed with a rare cancer. And while he was sick, I spent a lot of time in the hospital.
Mhm.
And I initially thought I wanted to be a physician, but I spent so much time with nurses who were so hands-on. If I
Yeah.
didn't, doctors were saying they would come to our family and give us more information. They were our advocates. You
Mhm.
if we wanted to go back and ask more questions, they were like the voice for the healthcare team, and they brought so much you know understanding and somewhat of peace in the most tumultuous and most devastating time of my life.
Right.
um, Unfortunately, my dad did pass away, but I remember prior to him dying, like when I would take care of him, he used to say, you're really gentle, and maybe something you should look into is being a nurse. I guess I
Mm.
took that and ran with it because when I did go back to school, he died the summer after my freshman year of
Mhm.
college. I ended up switching my major to nursing.
I
And
remember when you did that because you're biology.
yeah, I was
Yeah.
biology.
Yeah. Oh, I never knew that. So you
Yeah,
wanted to be the comfort that someone else was for you.
yeah, just it
Mhm.
just seemed to be so much more hands-on,
Mhm.
um, just much more in involved in the different facets of not only healthcare, but just being an advocate for the families. They were so knowledgeable. They were able
Mhm.
to explain so many things. And then I looked up one day and I was like, actually a lot of nurses in my life that I know of. So they end up being like mentors to me and kind of guiding me through
Right.
school.
Right.
So for
Beautiful.
me, good choice
Mhm.
to pick that as a career path. And I ended up actually working at the same hospital that my dad was being treated at.
Mhm.
I went back home and ended up working at that hospital for about 2 years. So so far, it's been a journey for sure. Not everything is beautiful about healthcare. Like I'm sure the story may be touching to some people, but it has its bad sides as well, good and bad.
Mhm.
But I try to embrace the journey as long as I've been in this career. So
Right. And I want to talk about some of the things that you've done because I guess another thing is when I think about you, and I made that comment about not really seeing variety in nursing, but you've actually had a lot of different types of roles within the nursing field. Because I know you worked in policy, which you said in the beginning, and you used to deliver some pretty sad news to people, right? When you were in the I can't remember what it's called, Bree, when you were in Michigan.
are you talking about when I was working in hospice nursing? Maybe.
No, you were working for the government, I think, and you'd have to tell people
Oh,
about their
this is when I was working in public health. So
public
I
health. Thank you.
Oh, yeah, so I was a manager at I used to do a STD clinic.
Mhm.
Not only did I do a lot of the examinations, but I had to do a lot of the tracking for the communicable diseases within the STD. So obviously, if you contract an STD, um, you have to, if it's considered a communicable disease,
Mhm.
obviously spread, it can spread throughout the community. It will be my job to not only notify that person that their test came up positive for particular STDs, but I needed them to list their partners. And if
Mm.
the responsibility of telling those partners, it was then my responsibility to tell them. So that was my most interesting job,
Yeah.
entertaining sometimes, because like sometimes people didn't even know their sexual partners' names. They just knew it was somebody down the street on the yellow house.
Mhm. Oh my
Or
gosh, yeah.
drive down to the yellow house. Yeah, reason to believe that you might have contracted communicable disease. Please come to our office.
Um,
Test you. So when looking back on it now, probably was not the safest job either. Um, to I had been in some shady places because I was
mm,
notified these people.
right.
Um, and it wasn't always the safest, but thank God I was protected.
Amen. Right. 'Cause I didn't even know that was a thing until you had that job. And I remember you
Well,
talking about that, like, that happens?
yeah, just like COVID with contact tracing,
Mm,
there's just not the stigma attached to it as much.
right.
So but just like we do contact tracing for COVID, where you're trying to notify those people who may have been exposed, it's the same concept. Like it's not a new concept.
Mhm.
That was one of my jobs, and it was, like I said, very moment.
So, yeah, so you've done that. You've been in the hospital. You've done hospice care, right?
Mhm. Done it.
Um, and I think you were on the road a lot when you were doing hospice care because you would, like, drive to different people's homes and do it in their homes.
Yeah, I did a lot of house visits. That was very, it could be depressing at times. It was a combination of things. It very could be depressing, very rewarding, very enriching, because you
Mhm.
have people who they've accepted the fact that they're at their last days.
Right.
So the focus is more on quality of life. And I think one of the beautiful things that I've seen was just how much emphasis was placed on, tying up loose ends with people maybe they lost contact with. Um,
Mm,
their last days with their loved ones are the best possible. But they're also depressing because it's like some situations were sad, like having a 32-year-old patient who got diagnosed with brain cancer and just got married 2 years ago.
Wow.
How do you console this patient? There's nothing I can do to really help that situation.
Mm,
So sometimes feeling helpless, but I think I learned the most from that patient population, just the value of life, um,
mhm.
what importance should be placed on things in my life. Even my perspective has changed in terms of how I prioritize things, because life is short and should be valued. But also even things like in terms of my thought process of the afterlife, there's,
Really?
yes, a lot
Okay.
of that I never allowed myself to think necessarily, but when you have people who are nearing the end,
Mhm.
there are revelations that they have, certain things they reveal. I just, like every time I have a patient that is close, like, because we've had, you know, typically or clinically for hospice to qualify for it
Mhm.
is if if the disease process takes its natural course, you typically will have 6 months or less. And you have people who have outlived their diagnoses. Studies show that when you focus more on quality of life, sometimes you can live longer.
Hmm.
So who've been on hospice for years, because they've outlived their diagnoses. And then some people that they meet those terms and they do succumb to their illnesses within that 6 month or less
Mhm.
time. But when I see them nearing like a couple weeks or days, I typically see there's certain senses that take longer to go. Appetite goes pretty quickly,
Mhm.
but the hearing does not. And I guess some people might have thought that people might be having hallucinations, but never fail. It seems like for a majority of those patients who have a couple weeks or a couple days left, they're always seeing angels or
Really?
or loved ones who have passed on,
Mhm.
um, that seem to be comforting to them. So
Mhm.
for that, I never thought to question before. I can't deny that that's their experience. So
Right.
um, it's been interesting to, because I'm that present person. I see them on a weekly basis.
Mhm.
They're telling me these things. It's just interesting, and it's opened my perspective in terms of life and death and how I look at it as well.
Wow. I never thought about that either, about just like those lessons that you learn from your patients because you're with them in the most horrifying moments of their life at
Mhm.
times. Wow.
Right.
Okay. So you've also been a professor, right?
Hmm.
Yeah. So that's something, another path you can take with nursing. Did you enjoy that?
I really did enjoy that a
Mhm.
lot. There's a time I thought that I probably wouldn't encourage other people to go into nursing
Mhm.
in traditional way. Well, more so not to encourage them not to go into nursing, but my approach to the nursing field and how students are educated would be different. So I guess for me it was an opportunity to bring that insight, because tradition
Mhm.
could be kind of rigid, and
Right.
I don't in every aspect can prepare you for when you actually get into the field.
Mhm.
And times while matriculating through your education in nursing, there are a lot of things that you may not be privy to in terms of your opportunities, for specialties, especially.
Mhm.
Um,
Mhm.
because I mean, I understand if you either do a 2 or 4 year program, there's only so much time that can be given, and the focus should be that you're going to be a safe clinician and that you
Mhm.
don't body. Um, but I think I was able to lend like a fresh young voice to the world of education and nursing. Um, and I enjoyed it. I love inspiring students and seeing that light bulb go off, whether it's explaining a disease process and how we would approach it, and trying to hone in on sharpening their critical thinking skills, and seeing that light bulb go off. Oh, this is okay. Like seeing them connect the dots. That's
Yeah,
like the part. So I enjoyed it a lot.
that's
The pop academia, not so much.
good. But the lives that you impact for the better. Mm,
Yeah, um I feel like I learned a lot from my students too.
mhm,
So it inspired me, and even with just like how I wrote,
mhm.
um, if I had certain publications or articles that I might have been working on, just listening to a student and their perspective might inspire different thought in terms of
Right.
how
I
I
didn't
would
even
write.
know you had publications. We'll talk
I'm
about that.
working on
Okay, that's awesome.
yeah.
Wow. I can't
I'm
wait to read them when they're at when when it's out.
out.
Um, yeah, thank you. So another thing that I wanted to ask you about too was like telehealth, because that's something else that you've done. So when it
Mhm.
comes to like telehealth versus like being in the hospital, what's your preference?
That's kind of tricky.
Hmm.
Um, 'Cause I think there's pros and cons to each. Um, Being at bedside, there's a burnout that you can experience because
Yeah.
there's just so fast that you have to do. So in terms of the longevity being bedside, it can be kind of tricky. Um,
Hmm.
but then, telehealth, although very like interesting, it can be it can get stale because you just
Yeah.
on the phone for hours and hours and
Hmm.
hours. Um, so although you're not on your feet all the time, it is something that can kind of get stale.
Hmm.
But that was an aspect of nursing that I enjoyed too. Again, like it was something that I don't think a lot of nurses are aware is actually an opportunity for them, where
Hmm.
advise patients of their health conditions and how what the outcome should be. There's several different facets even within telenursing.
Hmm.
Um, I probably enjoyed it the least though, because
Okay.
of how it could get after some time. And I mean, that industry is aware of that too, because I think after depending on who you're working for as well,
Hmm.
sometimes it can look different.
Right.
So sometimes you don't always feel like a nurse. Sometimes if say you're working for an insurance company or something, all of a sudden you don't feel like you're doing as much nursing. You could feel like a insurance benefit advisor
Hmm. Hmm.
for this.
Hmm.
Um, but if you want to take a back seat and you just want some downtime, that might be something you want.
It's a good thing. Yeah.
Yeah, I
Okay.
mean, case too, where
Mhm.
that could be incredibly fulfilling too, where they're coming, it be in situations where they're coming out of the hospital and you're following up to make sure that they're doing everything that they need to have all the things they need in terms of medication or whether it's equipment or
Mhm.
whatever the case, so that their chances and their risk factors for being readmitted are lowered. So that could be incredibly fulfilling too, because you build relationships with they're almost like clients.
Right. What's the craziest thing that you've seen or heard in your career?
Oh, the craziest thing?
Yeah.
Hmm. I don't know.
Mm.
Let's see. I know working in, like I said, in the when I was working in public health in the STD clinic that I
Mhm.
managed, that was very interesting. So maybe within that aspect, I recall there was a time where I was running a clinic
Mhm.
and someone was positive for a particular STD. And again, like I said, you have to notify other people. But this particular person was married.
Oh.
And so I had to essentially, I had to figure out how I could contact these people without blowing the situation up,
Mm.
because that's my business. But turns out I didn't really, I didn't need to because he ended up coming in with his wife. And then when they
Oh,
left, my next appointment, the mistress came in. So I guess he already let her know. The
okay.
only this is because I had to go through the history
Yeah.
and then the piece came together. Stuff like that, it was just very messy. Like it
Mhm.
like crazy stories, just very messy situations
That would stress
that
me out.
stress a little bit. But then again, it was just like, this ain't none of my business. I'm
Yeah,
just
that's true.
whatever you
Just
have
a
to
mess.
tell me, be forthcoming. It's HIPAA prevents me from telling
Mhm.
people certain identifying factors. So you don't have to worry about this leaving the clinic. But my
Mhm.
y'all is doing a lot.
A lot.
The people start to flood in terms of who I'm testing. I'm just like, ooh, we,
Mhm. Oh my gosh, that good point.
you
Okay.
know, little in terms of like other clinical aspects. I know for me, I could never work in peds. I hate seeing kids sick.
Mhm.
So it's hard enough seeing adults suffer and pass
Right.
away. I mean, in terms of like crazy things like that, in terms of circumstances where, um, you know, people have been led to the hospital. Like you see that all the time. Um,
Mhm.
but I know for me, one thing I just feel like I can't handle is being in the NICU or PED, seeing babies and kids sick. It's
Yeah,
really
I can understand that. That's difficult.
hard.
Okay. So recently you made this transition to travel nursing, right?
Mhm.
How are you liking that?
Um, Pros and cons, you know, like everything. Um, I think the good thing is like being challenged. You know, these situations you have to really be confident about your assessment skills.
Mhm.
Because you know, other situations where you would have 3 or 4 months to train, they're only giving you 1 to 2 days of orientation, if that. So you're
Mhm.
just thrown to the fire. If anything, in certain situations, just giving me the opportunity to explore different hospitals, different healthcare systems, and see who's doing really great and who needs improvement in what areas. I mean, I'm not there to judge or like scrutinize or anything,
Right.
but coming in as a clinician, you can certainly see where their strengths are
Mhm.
because you need certain resources in order to hit the ground running.
Mhm.
In certain hospitals where, I mean, it's not necessarily um may not necessarily be that particular hospital's fault, but you could see different the demographics that are being served. You can see where there's a lack of certain things.
Got it.
So certain areas where were more crowded or we didn't have as much PPE or, you know,
Mhm.
certain things do, you know, you just had to make do with what you had. I mean, the country really, as a whole, had faced that, but you could see certain pockets were more devastated than others.
Mhm.
Um, but definitely seeing, you know, like thrown in those situations and seeing if I could keep my head above water in terms of my skill set, exploring different areas, just, you know, not having to commit to somewhere for, you know, I'm here for years and years. Like, it's like,
Mhm.
I'm not liking the situation. I know I'm only going to be here for, you know, another
Yeah.
couple weeks. Like, so that was always good.
Yeah.
Um, I think some of the downsides is like, I don't think people really realize how much of a sacrifice we really make. We're,
Mhm.
you know, our families, we're going to these usually more isolated rural areas
Mhm.
typically. That's not always the case, but within COVID, you know, especially, you know, more devastated areas typically in more rural areas. And it can be a bit challenging when you are working all the time
Right.
and want to still have some form of quality of life and you don't have your community or your family or friends. So
That's a big sacrifice.
yeah, it
Yeah.
can feel isolating, I will say.
Mhm.
So
Mhm. I know I was just reading this article in, I think it was from NPR about a travel nurse who quit because of, you can travel nursing is more lucrative. And
Mhm.
she was in a position where her significant other worked remotely, so he could come with her, and their kid was remote learning. So for
Mhm.
2 years, they've just been on the road. I think she's been making up to like $10,000 a week on the road. But
Mhm.
now her kid's getting older and she's tired of just consistently moving all the time. And she's, at the point where she wants to go back to have a home base. And I hadn't really thought about that, about just leaving your family for weeks at a time and not having that support system home for you. So I
Yeah.
get that. So you did something recently, kind of to come back full circle to what you said in the beginning about self-care and learning that more and learning that from your patients even.
Mhm.
That I thought was just the most amazing thing. You went on a retreat in Central America for what, a month, I think?
Yeah, for a month. Yeah.
Yeah. How was that?
It was great. I definitely got what I needed out of that situation. I completely was burnt out.
Yeah.
Like I said, I really dealt with a lot of in addition to feeling so isolated, dealing with it's just a lot of pressure having to hit the ground running like that,
Mhm.
as well as just the trauma essentially and devastation that you can see on a
Yeah.
daily basis. Specifically, I'm not working a COVID contract right now, but when I was working those crisis contracts and having to see, that devastation, it doesn't, like, we're not okay. Like, you can't see that every day and just be okay.
Yeah.
It feels like as rewarding as you want it to and fulfilling as you want it to be that you're helping people are still dying at the end of the day.
Mhm.
You're grateful for the people who can get better and you're able to discharge and get them home, but just seeing what these families have to go through and trying to stand in the gap when having to tell a family member, I'm sorry you cannot come visit your loved one, like visiting has been shut down again because our
Right.
numbers are high. um Having to tell a patient, if you don't want to get this, happened on my last assignment. The patient's next step from BiPAP was to be ventilated, and
Mhm.
she didn't ventilator, so she ended up being on palliative care. And that was a particular case where we were able to allow certain family members come in, but not all of them could. And um she had a very rapid decline after that particular patient. But we see that all the time. Like, if that's very scary to be able to even just to consider, like, okay, if I decline even further, I'm gonna
Mhm.
have to plate it. Is that something that I want? And you have, if you're have the faculties to be able to do that, or your clinical your situation isn't as bad to where you can actually make a decision for yourself, because that doesn't happen all the time. You sometimes you just transfer it off to ICU. But this was a particular situation where she was actually verbalizing, and she was able to say, I don't want to be ventilated. And that was just really sad because it's like,
Wow, yeah.
it's emotional. You feel the emotions of these patients and the family members, and it can weigh on you. Um, and I tried very hard to, you know, not have that weigh on me, but it's
Mhm.
sometimes inevitable.
I mean, you're human.
Yeah,
It
I,
happens. Yeah.
I grace that I'm human too.
Mhm.
And I have empathy, but I can't be so empathetic that I take on everybody's
Mhm.
issues. So for me, I think I just kind of was internalizing a lot of things and didn't have an outlet, because it was just like, well, I have this much time left in my contract, so I just have to buck up to finish it,
Right.
or whatever the case. So for me, it was just very much needed. I just needed to shut off. I went to a yoga retreat.
Mhm.
I in for 21 days. Um, I just I just wanted to disconnect from the hustle and bustle and movement of everyday life and just kind of decompress and just really, just prepare myself for a better, healthier lifestyle. Even
Yeah.
now, I consider working now has changed because of the time that I took off. There's just certain non-negotiables that I have when I consider, certain work opportunities when it comes to, this travel situation.
Right.
Um, you know, not every situation is a great situation. So if
Mhm.
it does for me, because at the end of the day, this is gonna come to an end. Travel nursing will always be there. Nursing will always be there, but in terms of what I choose to do, I had to create certain boundaries for my own mental and physical and spiritual health. So
I mean, I
that,
think that's beautiful because I've even been reading a lot more about like nurses killing themselves just because of all the pressure. And hearing you talk about some of your experiences, I can understand why that would be so heavy and why you kind of internalize that way. So thank you
yeah,
for saying that. And I'm really happy you're taking that time that you need.
yeah,
It's healthy. And I hope that's kind of what people get from this conversation. In any field that you're in, it's necessary to take that
mm,
time because they'll
yeah.
find new people to do the job.
It does not matter what field you are in.
Mhm.
Just have to be able to self-assess and determine, is this, whatever it is
Mhm.
this me, and what do I need to do to be my highest best self?
Right.
Not even in a selfish way, just like so you can be your best self to whatever you show up for, whether that's work, your family, your love life, just being an everyday person in society. How can I be my highest self? And what in my life is contributing to either my depression, my anxiety, my stress, and how can I either eliminate it or how can I rearrange it? Because we all have to live. Not everyone, we can't just all pop up and be like, I'm quitting my job and move on a hike up these. It would be nice, but how
Right.
can I reset? How can I self-assess and determine what in my life needs to be rearranged? So that's
Mhm.
essentially what that trip did for me. And I'm still trying to fine tune stuff because I don't know what it is. I just have to always go or be somewhere, but I'm working on it. So
That's cute. You're a work in progress. You're
I'm
getting there though. I see it. All right, Brianna. Well, thank you so much for taking the time to speak with me.
thank you so much for having me. It was great talking.
Yeah, yeah, always. All right.